Hi guys, welcome to the healthcare channel. Today's video we'll talk about constipation. Constipation occurs when bowel movements become less frequent and stools become difficult to pass. It happens most often due to changes in diet or routine, or due to inadequate intake of fiber. You should call your doctor if you have severe pain, blood in your stools, or constipation that lasts longer than 3 weeks. Other key features that usually define constipation include, your stools are dry and hard. Your bowel movement is painful and stools are difficult to pass. You have a feeling that you have not fully emptied your bowels. Being a woman, especially while you are pregnant and after childbirth. Changes in a woman's hormones make them more prone to constipation. The baby inside the womb squishes the intestines, slowing down the passage of stool. Not eating enough high-fiber foods. High-fiber foods keep food moving through the digestive system. Taking certain medications, see causes. Having certain neurological diseases of the brain and spinal cord, and digestive disorders, see causes. How does constipation happen? Constipation happens because your colon absorbs too much water from waste, stool, poop, which dries out the stool, making it hard in consistency and difficult to push out of the body. To back up a bit, as food normally moves through the digestive tract, nutrients are absorbed. The partially digested food waste that remains moves from the small intestine to the large intestine, also called the colon. The colon absorbs water from this waste, which creates a solid matter called stool. If you have constipation, food may move too slowly through the digestive tract. This gives the colon more time, too much time, to absorb water from the waste. The stool becomes dry, hard, and difficult to push out. Symptoms: the main symptoms of constipation are difficulty passing stool, straining when passing stool, passing less stool than usual, lumpy, dry, or hard stool. Other symptoms include pain and cramping in the abdomen, feeling bloated, nausea, a loss of appetite. What does it mean if a person has abdominal pain as well as constipation? Find out here. Complications: constipation on its own can be uncomfortable, but it typically is not life-threatening. However, it can become a problem if it is a symptom of a more serious underlying condition, such as colorectal cancer, or if it starts to cause further damage. Damage that can arise as a result of severe constipation includes rectal bleeding after straining, anal fissure, which is a small tear around the anus, symptomatic hemorrhoids, piles, which are swollen, inflamed blood vessels in the anus, fecal impaction, which occurs when dried stool stagnates and collects in the rectum and anus, potentially leading to a mechanical obstruction. Other possible complications include reduced quality of life and depression. Seeking medical advice for constipation may help prevent complications. Causes: the following are some common causes of constipation. Lack of fiber in the diet: people with a high intake of dietary fiber are less likely to experience constipation. This is because fiber promotes regular bowel movements, especially when a person combines it with proper hydration. High fiber foods include fruits, vegetables, whole grains, nuts, lentils, chickpeas, and other legumes. Low fiber foods include high fat foods, such as cheese, meat, and eggs, highly processed foods, such as white bread, fast foods, chips, and other pre-made foods. Learn more about foods that can prevent and treat constipation here. Physical inactivity: low levels of physical activity may also lead to constipation. Some past studies have found that physically fit people, including marathon runners, are less likely to experience constipation than other people, although the exact reasons for this remain unclear. A study from 2013 notes that increasing mobility might help improve constipation among older adults. People who spend several days or weeks in bed or sitting in a chair may have a high risk of constipation. Aging: as people age, the prevalence of constipation tends to increase. Up to 40% of older people in the community and up to 60% of those in institutions may experience constipation. The exact cause of this remains unclear. It may be that as people age, food takes longer to pass through the digestive tract. Many people also become less mobile, which may also contribute to constipation. Medical conditions, medications, and a low intake of fiber or water may be other factors that lead to constipation with age. Changes in routine: when a person travels, for example, their usual routine changes. This can affect the digestive system. In an article from 2008, scientists asked 83 people about the digestive changes they experienced while traveling outside of the United States. The results showed that 9% of people experienced constipation when they went to another country. Eating meals, going to bed, and using the bathroom at different times than usual could increase the risk of constipation. Overuse of laxatives. Some people worry that they do not use the bathroom often enough, and they take laxatives to try to solve this problem. Laxatives can help with bowel movements, but regular use of certain laxatives allows the body to get used to their action. This may cause a person to continue taking laxatives when they no longer need them. The person may also need higher doses to get the same effect. In other words, laxatives can be habit-forming, especially stimulant laxatives. This means that the more a person depends on laxatives, the greater their risk of constipation when they stop using them. Overuse of laxatives can also lead to dehydration and electrolyte imbalance, internal organ damage. Some of these complications can become life-threatening. For this reason, people should talk to a healthcare professional before they start using laxatives. Not using the bathroom when necessary. If a person ignores the urge to have a bowel movement, the urge may gradually go away until they no longer feel the need to go. However, the longer they delay, the drier and harder the stool will become. This will increase the risk of fecal impaction. Not drinking enough water. Regularly drinking enough water can help reduce the risk of constipation. Other suitable fluids include naturally sweetened fruit or vegetable juices and clear soups. It is important to note that some liquids can increase the risk of dehydration and make constipation worse for some people. For example, those who are prone to constipation should limit their intake of caffeinated sodas, coffee, and alcohol. Colorectal problems. Some health conditions that affect the colon can impede and restrict the passage of stool, leading to constipation. Examples of such conditions include cancerous tumors, a hernia, scar tissue, diverticulitis, colorectal stricture, which is an abnormal narrowing of the colon or rectum, inflammatory bowel disease, IBD. Other conditions. Some other medical conditions can also cause or contribute to constipation. These include neurological conditions, multiple sclerosis, Parkinson's disease, stroke, spinal cord injuries, and chronic intestinal pseudoobstruction can lead to constipation. Conditions that involve hormonal function, electrolytes, or renal function. These include uremia, diabetes, hypercalcemia, and hypothyroidism. Intestinal blockage. This can occur if a tumor blocks or squeezes part of the digestive system. Conditions that affect the digestive system. Constipation can occur with celiac disease, IBD, and other inflammatory conditions. Cancer treatment, chemotherapy, and opioid pain relief medications can also trigger constipation. What is the link between diabetes and constipation? Find out here. In children and babies, constipation can sometimes affect children and babies. The following sections discuss this in more detail. Newborns. If a newborn does not pass meconium, their first solid stool, within 48 hours of birth, they may have Hirschsprung's disease. This is a condition wherein certain nerve cells are missing from part of the large intestine. The stool is unable to move forward in the affected area of the colon, which causes a backup. A healthcare provider will usually be able to spot these symptoms and recommend surgery as treatment. In most cases, the outlook is good for babies born with this condition. Young infants. If a breastfed baby goes a week without passing stool, this is not usually a problem. Breastfed infants do not usually experience constipation. However, if parents or caregivers have concerns about a baby's bowel movements, they can seek medical advice. More commonly, constipation can occur when an infant first starts taking formula feeds, during weaning, during potty training, at times of stress. If an infant experiences constipation while consuming formula feed, they may benefit from drinking extra water between feeds. Parents and caregivers should not add extra water to the formula, however. If the infant is already consuming solids, they may need more fiber and water in their diet. Fruit can be a good option. However, do not force children to eat if they do not want to, as this can cause or add to the stress. During potty training, constipation can occur if a child feels stressed, especially if other changes are occurring, such as starting at nursery. Giving the child plenty of time to empty their bowels may help. Apart from the not passing stool, some symptoms that indicate constipation in children include a firm or distended abdomen, low energy, reduced appetite, irritability. In pregnancy. According to one source, around 40% of women experience constipation during pregnancy. This can result from hormonal changes, physical changes, such as when the uterus presses on the intestines, dietary or physical activity changes. Many women take iron supplements during pregnancy. These can contribute to constipation and other changes in bowel habits. Treatment. Constipation usually resolves itself without the need for prescription treatment. In most cases, making lifestyle changes, such as getting more exercise, eating more fiber, and drinking more water, can help. Allowing time for defecation, without stress or interruption, may also help. People should also not ignore the urge to have a bowel movement. Laxatives can improve symptoms in the short term, but people should use them with care and only when necessary. This is because some laxatives can have severe adverse effects. The Food and Drug Administration (FDA) urges people to check with their doctor before using them and to follow the instructions on the label with care. If constipation persists, people should see a doctor. They may need stronger medication. The doctor may also test for any underlying conditions. Keeping a record of bowel movements, stool characteristics, and dietary and other factors may help find a suitable treatment. Some laxatives are available over the counter, while others are available with a prescription. People should only consider using laxatives if making lifestyle changes has not helped. It is best to check with a doctor before use. The following are some laxatives and stool softeners that may help ease constipation. Fiber supplements, also known as bulk-forming laxatives, these may be the safest option. FiberCon is one example. People should take these with plenty of water. Bulk-forming laxatives are available from pharmacies and to purchase online. Stimulants, these cause the muscles in the intestines to contract rhythmically. Senokot is one example. Lubricants, these help the stool move smoothly through the colon. One example is mineral oil, Fleet. Stool softeners, these moisten the stool. Examples include Collis and Surface. Osmotics, these draw water into the colon to hydrate the stool and ease movement. Saline laxatives are a type of osmotic. Neuromuscular agents, these include opioid antagonists and 5-HT4 agonists. They work at specific receptors to regulate movement through the gut. When to see a doctor. People should seek medical attention for constipation if the following symptoms also develop: severe discomfort or worsening symptoms, constipation that starts suddenly without a clear reason, ongoing constipation that has not responded to lifestyle changes, blood in the stool or bleeding from the rectum, constant pain in the abdomen or lower back, difficulty passing gas, a fever, vomiting, unexpected weight loss. Please don't forget to subscribe to our channel for more recommendations on health, relationship, lifestyle, and other helpful information to form life easier.